Hello, my name is David Trimberger, and this is attempt number 4 at IV Piggyback administration. First thing that I'm going to do is gather up all my materials, so making sure that I have my medication, IV solution, IV tubing, sharps container, tape, my label, and alcohol prep pads and proper PPE. After I've gathered up all my materials, I will then check with my medication orders. I will grab my labels, and then I will walk into my patient's room. When I walk into my patient's room, I will ask them if they can tell me their name and their date of birth, as well as I will introduce myself. I will compare their name and their date of birth to my label. After I've done that, I have determined that this is my right patient, so then I'm going to go through the rest of my 5 rights on my medication. So I'm going to check to make sure that this is the right medication, I'm giving it at the right time, this can be given through the route that I'm giving it at, as well as that I'm going to be giving this at the right time. I'm also going to be checking the clarity of the medication, as well as the expiration date. After I have done that, I will go ahead and pre-fill my syringe. So I'm going to make sure that all the air bubbles are out of my syringe. Okay. Attach a needle to the top of it. Then I'm going to come over, grab my IV solution. I'm going to check for the clarity, if this is the correct solution, the expiration date, as well as if this has both of its tail port covers. Then I'm going to grab my IV tubing, make sure that it has both of its tail port covers, this is the proper drip rating, and that the flow chamber is as close to and the flow clamp is as close to the fill chamber as it can, and that is closed off. Then I'm going to make sure that there's no kinks or twists in my tubing. I will then put on proper PPE. Going to inspect my medication one more time, grab my IV solution, check that this is my right solution, then going to inject my medication. Okay, immediately put this in my sharps container. I'm then going to mix up and agitate my solution. Then I will spike my bag. Turn it upright. Fill my fill chamber up to about halfway. Okay. And then going to the best of my ability, open up my fill chamber and not lose a whole lot of medication. Okay. Okay, after I have done this, I'm then going to hang my piggyback solution higher than my primary solution. Set this off to the side. Grab a new alcohol prep pad. Then I'm going to come over to my main line, turn off my mainline solution, take my alcohol prep pad, going to clean my Y port. Then I'm going to take my secondary line and attach it to the primary line. Take some tape, tape the secondary to the primary, then come over and adjust the flow rate on my secondary line, get it to the proper flow rate, adjust my primary line to its proper flow rate. After I have done that, I will then take my label my medication, and then I will monitor my patient for any adverse reactions, any change in patient condition, as well as any undesired side effects. Thank you.